meets West, alternative meets traditional. These are a lot, or Western, I should say. These are a lot of the subjects that we're going to be dealing with and looking at and taking apart today. The first speaker that we have is an amazing doctor, Dr. Cary Presant. I met in Washington, D.C. He's very proactive in D.C. in trying to raise the bar on policy to help all of us. He's an amazing hematologist. He's an incredible oncologist. He's an author, and he also practices out of the City of Hope, as well as works at the USC Keck School of Medicine. Please, I'm very eager to hear you listen to this very smart guy that is basically practicing Western medicine, but has the vision to incorporate East and West. So please give a warm welcome to Dr. Cary Presant, my dear friend.
Thank you, Fran.
Thank you.
Good morning, everyone. I want to welcome everyone to Fran's Summit. I was here last year, got tremendous numbers of questions afterwards. We had wonderful conversations, so I urge you, after I'm done today, if you have questions, just see me in the halls, see me at the food bar, see me wherever. But I've been asked today to talk about, talk about traditional versus alternative medicine. And I don't quite look at it like that. I look at it more as a partnership, not as an either or. I'll talk about it from the oncology perspective, which has been my life. But I wanted to point out that the cancer challenge is one that each of us faces. We face it ourselves, we face it in our families, and part of Fran's mission to detox is to prevent cancer in you, in your family, in your friends, so you can be a leader in your own social world when you come home from here today. But cancer is a big problem because 1 out of every 3 women, 1 out of every 2 men get cancer over the course of their lifetime. Undoubtedly, it has affected your family in some way, and I hope and pray it's not been serious. But we know that there will be millions of cases of cancer this year and in coming years. We know that there will be lots of deaths from cancer, and you probably know people, friends and family, who have passed away from this terrible disease. So our goal is to try and see what can traditional medicine do, what can alternative medicine do, so you have the best of both possible worlds. You see the most common cancers, and they certainly have affected my family, probably your family as well. But what has traditional oncology achieved? Do we have to throw all of traditional medical practice away, or is it really achieving some progress? And so, first of all, we have to realize that in one of the most amazing turnarounds that has ever been seen in all of medical care, the cancer mortality, how many people are dying from cancer, has decreased by about 25% in the last 20 years. This is remarkable. And it's because of you and your families, Fran, and our leaders who provide us with information that this has happened. It's both in men and in women that mortality has decreased. The survival, once a patient has gotten cancer, has also improved very dramatically. Back in 1975, the Middle Ages, survivorship was only about half. Today, survivorship is approaching 3/4, and this is because of treatments and because of what people are doing during survivorship years and paying attention to things, many of which you'll hear about today, so that people can maintain good quality of life, good commitment to the types of treatments that they want to have, both traditional and alternative. And look at the survival for breast cancer, for prostate cancer, for melanoma. These are extraordinary survivals which we didn't enjoy in the last century, but today we are able to enjoy these here in the United States. But we still have big challenges: pancreatic cancer, liver cancer, the cancers you see up here. These are not showing increased survival. We know that in our communities there are lots of cancer survivors, and you know, just around you, you know people who have survived cancer. You know Fran, she survived cancer, and look at what she has made of her life as part of her survivorship experience. We know that, very importantly, Fran is very committed to prevention. We're all committed to prevention, and that's one of the major reasons that you're here today. We know that that traditional oncology has provided a lot of answers to how we can prevent cancer. And you can see that in general, exercise, diet, weight control, limiting alcohol intake, these are logical things. You've heard about them before. I will re-emphasize them today. Very important. But we know that we also have medications that actually can prevent cancer. And you see those in breast cancer with tamoxifen, raloxifene, aromatase inhibitors. These are medications which you, after discussion with your doctor, can take if your risk is high. So one take-home lesson is you better find out if your risk is high based upon your family history and your lifestyle. We know that prostate cancer can be prevented, not just detected early, but really prevented. And you can see the kinds of medications there. Look also and see all the other types of approaches for all these different types of cancers. These can be reduced, and you should be taking home questions to your doctor about, well, how can I prevent these cancers in me and in my family and in my kids, the people that I care about and the people I'm responsible for. We also know that screening is very, very important because when we first started Cancer Schmancer, I was privileged to have Fran ask me to help to work on some of the first setting up of the board and setting up of the organization. And when we looked at this, we said, stage 1 is the cure for most cancers because that's when cure rates are the very highest. So to make certain that if, God forbid, you should ever get a cancer that is found in stage 1, earliest stage of cancer, that's very important. So you can see there are multiple different types of approaches which traditional medicine has provided to enable us to find cancers at the earliest possible stage. And after you go home, if you'd like a copy of these slides, just let the people here know and we can provide these to you. We'll email them to you, so make certain you have a method that we can get these out to you. The other thing that is important, we've talked about the toxicity of traditional medicine. Toxicity of traditional approaches, whether it be chemotherapy or surgery or radiation therapy, we know that this has been very, very tough in the past. But traditional medicine today, with research that has gone on, not only at City of Hope and Keck, USC School of Medicine, but also throughout the country, we know that toxicity of treatments is much less today. But you have to make certain if someone in your family, or even, God forbid, yourself, is facing therapy for cancer or any other serious condition, you want to find out about the side effects and you want to know how can you limit those side effects. And we've been able to do that in the types of traditional therapy that we give to cure cancer. We know that robotic surgery today allows patients to get out of the hospital sometimes the same day, sometimes the next day, whereas previously they stayed 10 to 15 days to recover from traditional big operations. We know also that with radiation therapy, we get less side effects, less burning with the newer types of techniques. There's tomotherapy, there's IMRT, there are treatments with proton therapy available in this community out at Loma Linda. We know that these types of approaches can reduce the likelihood that a cancer survivor will have big problems they have to deal with. We know also that the new types of chemotherapy that we have developed, when I developed the first nanomedicine, a liposomal chemotherapy, we found that it was much less toxic than old traditional forms. And today, there are about 5 or 6 different liposomal therapies. There's other types of nanomedicine therapies that have fewer side effects than ever before. We know also that there are methods such as additional growth factors that can protect the bone marrow. We know there are chemocaps that can protect against hair loss. So a lot of the side effects that we previously have seen are reduced today. But most importantly, we know that the genetic revolution, the genomic analysis of cancers, has allowed us to look at targeted therapy much more effectively. That allows us to target in on the treatment of the cancer and avoid side effects with the rest of the body. We know that antibody therapies, which have been developed here in Southern California, have been gone worldwide and now can give tremendous protection. And we know that immunotherapy, the latest advance, which over the past 2 or 3 years has consumed front pages of the LA Times and the New York Times and every place else in the country. This immunotherapy is very, very good because it increases your own body's immune response that can cure or control cancers for long periods of time. So is this really traditional versus alternative, or is it really, with the advances that we've seen in traditional, is it traditional plus complementary? Let me tell you what happens in my practice at an academic medical center, City of Hope, out in Duarte. About 80% of our patients are already taking complementary medications. People might call them alternative, but they really aren't. They're complementary. They change their diets, and you'll hear a lot about diet today. They're taking vitamins and nutrients. You'll hear a lot about that today. We know that a lot of them are using meditation. We actually have meditation programs, yoga programs, acupuncture programs at the medical center and at the hospitals related to the medical center. And because of this, patients have a better quality of life and less side effects from the treatments that they have to receive. Every comprehensive cancer center, these are cancer centers supported by the national federal government, and they're all over the United States. There are about roughly 90 of them now. Everyone has a CAM program, which is Complementary and Alternative Medicine Program. And the doctors know how, increasingly know how, not everyone, but increasingly they know how to integrate the alternative medicine treatments to make them complementary to the traditional approaches that we use. So here's the most important message for you today. There are things that you can take home and discuss with your doctor today, even if you don't have cancer. I know everyone in the room fears cancer. It's the most feared disease in the world. So the take-home questions for your doctor are, number one, what is your risk of cancer? Is it just average, or do you have a really high risk because of your lifestyle, or do you have a high risk because of your family history? Doctors today have tools, online tools from the National Cancer Institute and from other places to actually tell you exactly what your risk is of certain types of cancers, and they can also tell you your risk of other things like heart disease, lung disease, et cetera. This is very important. Second question for your doctor, should I have genetic testing? And this is important because sometimes we realize that with a family history, we can identify exactly what the gene mutation is, and then your kids can be tested as well, your brothers and sisters, to know who's at high risk so they can decide how to prevent and detect early. What are the screening tests that you should get? How are you going to prevent cancer? These are very important. And lastly, are there complementary methods, diet, vitamins, et cetera, that really can help you to reduce your risk of getting cancer? But if you have cancer, God forbid, or someone in your family or friends, you need a plan for the traditional therapy, but you also have to ask, is there a way to keep the toxicity down? Is there a way that I can reduce the side effects of this therapy so I can get through it and really survive well? Are there complementary methods that you know of that can help me as well? Talk about diet, talk about nutrition. And can you take these traditional therapies together with the alternative therapies successfully and safely? What happens if your doctor doesn't know how to answer these questions? I've asked some of these questions of my doctors. One of my doctors couldn't answer very well, and we replaced them. I think that one way to look at this is to use some clues in my book, Surviving American Medicine. It's back in the bookstore, and they're signed copies that you can get that tell you how to ask questions of your doctor and tell you when it is time to get a second opinion, because a second opinion or a consultation to give you additional information can save your life, can save the lives in your family. So take-home lesson today is that there is homework that you have to do, not only in terms of how you change your lifestyle, but also in terms of how you deal with your doctor for not only cancer, but for other medicines as well. There are tools available to you, and you'll hear about lots of these today. Be sure to take some home, as many as possible, so that you can really work over the next 6 months to get your health together. And just remember that the best health in the future is using the medical system that you have available to you today that has achieved so much, together with the complementary and alternative types of approaches that you'll hear about today. Thank you.